Have you ever taken a pill for a headache and just stopped and thought, how does this thing know to go to my head? Well, today we're going to pull back the curtain on the incredible science of how a pill knows exactly where to go. I mean, seriously, think about it for a second. You swallow this tiny little thing, and it goes on this massive journey through your body. How on earth does it navigate that complex inner landscape to find the one spot it needs to fix? It's not like it has a tiny little GPS, right? Okay, so here's the secret. It's not magic. It's all about incredibly smart chemistry. You see, medications are designed to talk to specific control systems that are already running inside you, things like your nervous system. Think of them like specialized keys engineered to fit only very specific locks inside your body. So let's start with the biggest, most complicated control system of them all, the brain. And to do that, we're going to look at a pretty common sleep medication to see how this whole targeting thing really works. A lot of us have probably heard of Zolpidem, maybe by its brand name Ambien. It's what's called a sedative-hypnotic, and its whole job really is to help people who are struggling to fall asleep or stay asleep. So how does it pull that off? Well, Zolpidem makes a beeline for your central nervous system. Once it's there, it finds a neurotransmitter called GABA and basically cranks up its volume. You can think of GABA as your brain's natural dimmer switch. So by enhancing it, Zolpidem just dims the lights on your brain activity, which leads to sedation and, well, sleep. But here's the catch. When you're messing with a system as powerful and interconnected as the brain, the effects aren't always going to be perfectly contained. That dimmer switch doesn't just control sleep, it affects a lot of other functions too. And this really highlights one of the biggest challenges in pharmacology, trying to make a drug that only hits its target and nothing else. And this is exactly why you can get a whole range of side effects, all because of that general dimming of the central nervous system. Since the drug isn't laser-focused, you can end up with things like drowsiness the next day, dizziness, or even memory issues. It's all connected to that same command center. And sometimes the effects can be, well, pretty wild. Some people have reported doing complex things like driving a car or cooking a meal while they aren't fully awake and then have zero memory of it later. It's a pretty stark reminder of just how powerful these brain-targeting drugs can be. Okay, let's stick with the nervous system, but shift our focus a little. Instead of inducing sleep, let's look at a drug that's designed to calm down nerves that are firing way too much, the kind of electrical chaos that can cause anything from seizures to chronic pain. For this, our example is Gabapentin. It's technically an anticonvulsant, and its whole purpose is to tell nerves that are going haywire to just quiet down. And here's where pharmacology gets super fascinating. Even though gabapentin is used all the time and we know it works, scientists still aren't 100% sure exactly how it works. The precise way it calms those nerves is still a bit of a scientific mystery. But even with that mystery, its ability to soothe overactive nerves makes it this incredible jack of all trades. It's used to help control seizures, to treat that awful burning or tingling pain you get from nerve damage, and even to manage the creepy-crawly sensations of restless leg syndrome. So, we've been hanging out in the brain and nervous system for a while now. But what happens when the problem isn't in your head at all? Let's zoom out and see how pharmacology can target a totally different system, your lungs. And for this, we're going to dive into asthma medications. With these, the goal isn't to hit a dimmer switch in the brain. Nope, it's all about going directly to the airways to deal with inflammation and muscle constriction right at the source. Asthma treatment is actually a really clever two-pronged attack. On one hand, you have what are called maintenance medications. You take these every single day to keep inflammation down and basically stop an attack from ever starting. Then, on the other hand, you have rescue medications, which are for when you're in the middle of an attack and need to open up your airways fast. So for maintenance, you're looking at things like inhaled corticosteroids, which are great at reducing inflammation, or other long-acting drugs that work to keep the airways relaxed over a long period. The name of the game here is prevention. But rescue meds like Albuterol are all about speed. They work incredibly fast to relax the muscles squeezing your airways, giving you that immediate relief when you're struggling to breathe. It's a perfect example of how drugs can be designed for both long-term strategy and rapid emergency response. Okay, so we've seen how these drugs can target the brain for sleep, calm down hyperactive nerves, and manage our lungs. They are amazing, targeted tools, but they are often just one piece of a much, much bigger puzzle. So for this last part, let's zoom out from the pill itself to the person who's actually managing a chronic condition every day. This quote right here, it does such a good job of describing what nerve damage or peripheral neuropathy actually feels like. People feel numbness and tingling that starts in their fingers and toes and slowly moves up their arms and legs, just like they're pulling on stockings and gloves. It really paints a picture of what life is like with this condition. And for conditions like this, a pill is almost never the whole answer, not even close. Real health management is a much bigger, more holistic thing. It combines that medication with a ton of other strategies. I mean, just look at all of this. We're talking about huge lifestyle changes, like diet and exercise. We're talking about physical and occupational therapy to keep your body functioning. And then there's all the crucial self-care, like checking your feet every day because you might not even feel an injury. It's an active, all-in approach to staying healthy. So that really leaves us with this final thought. While the science that gets a pill to do its job is, absolutely incredible, maybe true health isn't just found in a bottle. Maybe it's found in all the choices, the therapies, and the care that we use to support our entire system. What do you think?